All right. Thank you, Jessica. Thanks everybody for joining us this afternoon to participate in this teletown hall. We hope you like this format. It's really allowed us to do a lot more outreach to more veterans as we conduct these town halls throughout the year. Today, our focus is specifically on our women veterans, on you. So I'd like to preface this session with a brief statement about the importance for us of creating a welcoming environment to our hospital and our clinics for all our veterans. I've been here for many years, first came here in the mid-'80s, and I've had many women veterans tell me over that time that they felt like they were being harassed when they came in seeking care at our facility. At times, women veterans have felt threatened or uncomfortable in accessing our services. Often, they're assumed to be spouses or caregivers and not a veteran themselves. I just want to say affirmatively that harassing behaviors are completely unacceptable and won't be tolerated. Madison VA is here for all veterans who serve, and we want all veterans to feel welcome. So our goal today is to hear from you, our women veterans, so we can continue on that pathway to providing excellent and harassment-free health care services. I look forward to your questions today, and thank you for your participation.
While we're getting some questions queued in and while questions are coming in, let's begin with answering some of the questions we received during the previous Women's Health Teletown Hall. One of the questions that we had received previously was, where can I get a new ID card, and do I need one?
Hi, my name is Liana Flores from Patient Administration Services. Veteran Health ID cards, also known as VID cards, can be obtained by presenting in person at any of our CBOCs or the main hospital. Call ahead to confirm availability at 608-256-1901, extension 17038. Cards that are not required to obtain medical care and are not usable as an insurance card or for ID purposes. They are for VA use only to expedite pharmacy and clinic check-in. VID cards are also shown to retailers requesting proof of military service for entitlement to discounts and promotions.
A second question that we had received was regarding our women's health walls. The question was, when you walk down the corridor on the first floor, there are nice pictures of male veterans and their stories. There are no personal stories about women veterans. I would like to know why we can't have women veteran stories on the wall like the male veterans.
So the Wall of Heroes has specific eligibility criteria, and that includes combat. So women veterans have technically only been allowed to participate in combat since 2013, and even though we all know that our women on active duty have been servicing this country along with the men, including exposure to danger. So to recognize our women veterans, the I Am Not Invisible display was permanently placed in March of 2021 on the first floor C wing between the Eagle elevators and the cafeteria. The I Am Not Invisible display enhances the visibility of women as veterans, recognizing the service and contributions of women in the military, raising awareness of the responsibility to treat women veterans with dignity and respect, and advocating for cultural transformation that eliminates the gender-based harassment behaviors.
I think while we are waiting to get a couple more questions queued up, we'll have Abe Rabinowitz give a quick COVID update.
Thanks, everybody, and good evening. It's great to be able to talk to you. I know COVID is something that's been on all of our minds for far too long, but we wanted to give you a quick update on where we are in response to the COVID pandemic at this point. And while we're hopeful that the recent surge and spread of the Omicron variant is on a downward trend, it's important that we all take appropriate steps to keep each other safe. You may have seen recent news that the CDC is now encouraging people to wear the safest face covering you have access to in indoor situations where there may be crowds, and that the federal government will be distributing 400 million free N95 masks to health centers and pharmacies to encourage broader use of safe face coverings. Here at the hospital, we continue to strongly encourage basic safety precautions, including mandating well-fitted face coverings at all times. With this latest guidance, we're encouraging use of an exam-style face covering over cloth and strongly discouraging use of gaiters, scarves, or other face coverings. If you're attending any sort of crowded indoor space or are planning to travel, we encourage the use of an N95 or KN95 mask. These masks may be slightly less comfortable, but they do offer added protection and will decrease your chance of contracting or spreading the Omicron variant. While wearing a face covering when indoors is important, still, the most important thing you can do to protect yourself and others from serious illness is to get vaccinated and boosted. Data is clear that vaccination and boosting reduce your vulnerability to COVID-19. Getting vaccinated not only strongly protects you from serious illness or death, it also helps to protect our broader community. If you've not yet been vaccinated or you need a booster for your vaccination, please call our vaccine hotline at 608-280-3160. That's 608-280-3160. We can make an appointment for you at our hospital or at any one of our community-based clinics. And last, if you are experiencing COVID-19 symptoms, please contact our nurse triage line at 608-280-7066. Our nurse triage line can work with you to assess your symptoms and counsel you on the next best steps to take to keep yourself and your family safe. Unless you are having symptoms that are an emergency, please use this nurse line rather than presenting to the emergency room for care. The emergency room has seen a large increase in workload during this COVID period, and it's important we reserve that resource for those who are acutely ill. The nurse triage line exists to provide you ready access to care for non-urgent symptoms. So if you're worried about symptoms, please call us at 608-280-7066. We encourage everybody to stay safe and for all of us to help each other to work through this pandemic by taking these simple precautions here in the hospital and more broadly in your local community. Thanks very much.
Thanks, Babe. We've got some questions queued up here, so I think we'll start taking questions. We have first up Lynn.
Hello?
All right, Lynn, you're on. Yep, we hear you.
Oh, wow. I thought that the lady I talked to was going to relay my question. Okay. This is more along the pharmacy question. I suffer from incontinence, and I get my pads from the VA. When I first was getting these pads, they were huge as far as the length of them were very long. It almost reminded me of pads that you might get in the 50s or 60s. I know that sounds a little crazy, but and then the next time I was prescribed them, they were very bulky as far as thickness, and because I'm supposed to wear them 24/7, they almost seem like they never breathe, if that makes any sense, if you're familiar with, feminine hygiene products. But I know that the pharmacy doesn't have an alternative for what they prescribe right now. What I was wondering was if there's a process to go through or a way that it can be recommended where one of the pads like that's available on the commercial market that's a little smaller in size as far as thickness, but is thinner, but has something that's called wings. Because as a woman, even when you just have your normal menstrual cycle, but especially with incontinence, when you have an accident, oftentimes it's very sudden and it's there's a lot of it, and it seeps over the sides of the pad. So the ones with the wings really help to protect all of that. So I was wondering if there's a process to maybe go through and a request through that whole vendor purchasing process, if they could get an alternative to what is currently provided for, incontinence prescriptions.
We do have Rachel here with pharmacy, who might be able to give us some details on the different incontinence products that we have available.
Hi, Lynn. This is Rachel. I'm one of the pharmacists. Can you hear me okay?
That's if you won't answer.
Oh, okay. You won't answer. I just heard. So, Lynn, thanks very much for your question. Regarding additional products that we have for incontinence, I'll be transparent. I'm not 100% sure of all of the different varieties that we have, though I know that there are quite a few. I'd be happy to take a peek at what we have available specifically for women and incontinence products, and then I can take down your name and information so that I can reach back out to you to let you know what we might have that you haven't tried. And then if we've tried everything, we do have processes in place for potentially considering medications to be added to our list. So we could certainly walk through what that might look like.
Thanks, Rachel. All right, we have Loretta on next. Loretta, are you there?
Just read your question.
Okay, I'll read your question out for you. What opportunity do women with, oh, sorry, it just popped away.
We're going to have to do the next one. I can't read that.
Okay. I think it was something along the lines of chronic UTI has the opportunity to be involved in research studies.
Yeah, that's what it was.
Jessica, let me go ahead and approach that. This is Dr. Bridges here. We have a very active research program here, and the VA has very active research studies going on across the country. So I think what I would suggest is that if you let the patient advocate know of your interest in studies and ask them to get that information to me, I will personally do an assessment of what research projects are going on across the country and see if we can get you entered into that or whether there are other opportunities to approach your issue rather than just the routine medications. And I agree with you. There's a lot of opportunities out there in this area, and there's also a lot of misinformation. So we want to make sure and help you in the right way. But I'll do some research on that, and if you could get your information to the hospital, I'll make sure that gets to you. Thank you.
Thanks, Dr. Bridges. Next we have Deborah. Deborah, you're on. Are you able to talk? Are you able to hear us okay?
Yeah, I'm here.
Okay, awesome. It looks like you have a question about Medicare working with VA benefits.
Yes. I'm just getting ready to start my Medicare paperwork, and I was wondering how that works, along with my VA.
Hi, Deborah. This is Liana Torres from the Patient Administration Services. So we get this question often from veterans, and we don't tell them you should get Medicare or you should not get Medicare. What is important for you is to understand your benefits as a veteran and what are your entitlements with the VA so you can better choose what you need with Medicare, and I'll give you an example. A veteran that is not travel eligible, it will be beneficial for that veteran to obtain Part B because Medicare Part B could cover the cost of an ambulance ride. And there are more things to it, of course, so if you have any questions, you can reach out to the health benefits area at 608-256-1901, extension 17038. Again, they won't tell you which insurance to get, but we can explain your VA benefits better.
Thanks, Liana. All right. Next question, we have Kelly. Kelly, you're on if you're able to talk to us. It looks like you have a question about traveling vets.
I do, yes. Hi, everyone. Thank you for this evening. My question is, I'm a traveling vet from Toma and in Arizona, but in Arizona, I'm about 3 hours away from the Tucson VA, and I only have a CBOC with limited staff. But my question is, when it comes to women care for like our annual or mammogram, when they go to refer me out for community care because I'm too far from the VA itself, Tucson VA says you have to go to your TOMA because that's who you're assigned through. And then TOMA says, no, you have to go back to Tucson because we don't have access to the doctors there and it's only our network. So they keep fighting back and forth, and then I just fall through the cracks and nothing happens. Even though I keep calling and calling, it starts the process all over again. So, I mean, not specific to women issues, but just, for instance, it's been over 3 weeks that I've had a broken tooth and I have dental coverage through the VA that is cutting my gum over and over, and Toma and Tucson keep fighting.
Hi, Kelly. Yeah, my name's Katie. I'm the supervisor for community care here in Madison. Although your scenario doesn't specifically fall under community care, it's more of a traveling veteran situation. Community care usually works with the communication piece in kind of handing off your referral for community care to the traveling veteran coordinator. So given that you're in Toma, I'm happy to take your name down and relay that information and see what we can do just to kind of streamline that process. It does, you're totally right. It does kind of fall into this gray area of where is your service. And we have plenty of snowbirds that'll go down south for the winter season, and we do see this quite often. So for recommendation in the future, when you do, Kelly, go down, I would, first thing before leaving would be follow up with have your primary care, have some outreach done to a traveling veteran coordinator at Toma to see if they can be proactive with setting up your referrals and the cares that you're going to need while you're down there. But like I said, I'll be happy to take your information and see what I can do on this end to, prevent any further delays.
Thanks, Katie.
And for anybody else out there who travels, I think it's important to know that all VAs do have this position of the travel veterans travel coordinator, and it's very helpful if you are going anywhere to contact them prior to that so that they can help you all the way through.
Yeah, I know our traveling coordinator here is Judy Geisler, and she has been amazing to work with. She does a lot for our veterans here. Christine, would you like to give a quick update on our new East Clinic and West Clinic remodel?
Yes, absolutely. We've finalized our building plans for a new community-based outpatient clinic on the northeast side of Madison. It's located by Interstate 9094 and Highway 151. The new East Clinic will be over 29,000 square feet and offer primary care, pharmacy, physical therapy, blood draw, radiology, x-ray, and whole health services with anticipated construction completion January 31st, 2023. So it's about a year away. And a target date for our grand opening is in April 2023. Approximately 70% of our women veterans coming to the Madison VA live on the northeast side of Madison. We're hoping the location and expansion of this clinic will offer you greater access to care. And then the West Clinic will also be remodeled, and remaining services will include 5 PAC teams, including a women's health PAC. And the West Clinic will expand whole health services offerings and will continue to offer blood draw, telederm, and an integrated mental health.
Thanks, Christine. We'll get back to a couple more questions now. We have Deborah on.
Hello.
Deborah, can you hear us?
Yes, I can.
All right, we can hear you.
Okay, my question is, there's a lot of male doctors, I guess not a question, situation, that do not understand the fact of what female veterans have been through while they've been serving, and they're, as I put it, too touchy. They try to explain something to you, but they talk to you with putting their hand on your arm or their hand on your knee, mainly male doctors. And then they treat you kind of like they downgrade you. And if you try to report it, it seems like the people you're reporting it to downgrade you. And it just is not satisfactory. And if it's happening to me, I'm sure it's happening to others. I just recently, within the last few years, learned how to speak more and tell people exactly how I feel, that I don't like them doing it or they kiss my butt type thing. And I really think male doctors need to be talked to about how to treat a female veteran. Thank you.
Thanks for bringing that up, Deborah, and I apologize that you've had those experiences.
Yeah, Deborah, let me just say that we are doing a lot more training in the area of sensitivity, not only to our female veterans, but to our minority veterans, and we have a very robust DEI program, which is diversity and inclusion, going on, which just hired a trainer in that will be coming on board. And these are all the types of things that we would be looking at to make sure that we're treating everybody the way they deserve to be treated, and not treat people different because they fall into one category or another. That's very important to us. And again, like Jessica mentioned, I apologize for the fact that you have had to go through that and feel that way. And I do promise that we will continue to increase our sensitivity training in these areas, and I really appreciate you bringing that forward.
All right, next question, we have Ada. Ada, you're on. Are you able to talk?
Are you talking about Ada? ADA?
Oh, yes, I apologize. Ada.
Okay, already asked my question. Do I repeat it? So my question has to do with identification cards. You talked about it before, but it was not an harassment. I am a veteran from 1960s. My husband is also a Vietnam vet. I have been to Madison, and I go over there probably 3 or 4 times a month. I have gone and asked, how can I receive an ID card? Okay, identification card. They tell me because I am not being serviced medically, because I don't go over there to have a doctor see me, that I cannot get an ID. And I said, I'm a vet. I have been a vet since 1967 when I left, or 69 when I left the military. And they sent me to another window where they check my, how much I receive in my pension, because I'm retired from the state of Illinois. And the last thing is, you don't qualify. And I says, I'm available. I will be willing to come here and pay my ID. And pay my deductible. And they say, you don't qualify to have your ID. Just because I make too much money in my pension, I just don't, I feel like every time I go over there and ask the question, is like I'm harassed or something just because I retired from the state of Illinois. That's my first question. So
I might, Leon, this one. You might have some more information from Patient Care Services.
Hi, Ada. We do have parameters to for the eligibility for veterans to receive care. We acknowledge that not all veterans are eligible for VA care. I'm one of them. So I apologize for that.
Yeah, there is a lot to eligibility. So, and I would hope that if you are making those trips here with your spouse, that you're getting to talk to our eligibility specialists down by the emergency department, because they could explain and also give you some material, or I think it's probably online now. It's probably almost all electronic, so you could probably just get it at your home. And it explains who is and who is not eligible for VA care. So it really doesn't have anything to do with your card. It's more you're eligible for care or you're not. Once you're eligible for care, then you could get your card. So that's the way that would work. But it sounds by your explanation that you're not eligible for VA services at the moment. But certainly, I think because of the difficulties in explaining it in the setting we're in, it would be well worth sitting down and talking to one of our staff or having a conversation with them over the phone.
And we can take down your information and get you the number for the eligibility department to get more details on that, so we can't review all those specific details we can't go through today. All right, we have Deborah. Deborah, you're on if you're able to ask your question.
I'm sorry, I have two questions. The first one is, will I be able to get the N95 mask at the VA hospital in Madison? And the second question is, I was involved with the Gulf War, what would you call it, survey, study, but then COVID hit, and I haven't heard anything else. I'm completely paid up for, time and travel, but I was under the impression I would get the blood results of from the study that I was given. Can you help me out?
Hi, Deborah. This is Abe. I can respond to the first question regarding the N95 mask availability. At this time, VA is not part of the distribution plan for those 400 million free N95 masks. What I would encourage you to do is just follow the news to identify whether there's a community health center or a participating pharmacy near you, and hopefully there will be a convenient location where you can participate in that program. But we are not part of that distribution network right now, though we do promote everyone trying to go out and find free access to those resources.
And this is Dr. Bridges. I can try to find out some information about the Gulf War survey from research. And if you would call the patient advocate with your information and let them know Dr. Bridges is checking on some things for you, we can get that information back to you.
Thanks, Deborah. All right. Let's see. We're getting another one queued up here. We have Lee up next. Lee,
hi, this is. Yes, I can.
Okay, great.
So my question is, I have necessary but elective foot surgery coming up, and with the COVID-19 surge, I'm wondering if there's any thought about, are these going to be postponed? What's the criteria?
So, Lee, this is Dr. Bridges. Were they planning to keep you overnight?
She can't talk back.
Oh. So, Lee, that's really the question, is if you are going to have your surgery done as an outpatient, we are continuing those surgeries. However, we are limiting elective surgeries for patients that need a hospital bed because of the COVID surge. Because there has been a little bit of a downtrend over the last handful of days, we're keeping a close eye on that, and I'm hoping that we'll be able to allow elective surgeries again in a couple weeks.
Thanks, Dr. Bridges. Thanks, Lee, for your question. We are taking a question from Sally. Sally, you're on if you want to ask your question.
Yes, my question is, I'm a senior female, and I'm wondering how often we're supposed to have a Pap test.
Hi, Sally. It depends on your previous results history from previous Pap smears, and it depends on your age. So generally, women who are 65 and older, if you've had no abnormal Pap in the last 20 years, we can actually stop Pap smear screenings. That isn't to say, if you're having some sort of symptoms, your providers can still do a pelvic exam to see what's going on. But as far as cervical cancer screening Pap smears, we do generally stop them after age 65 for women. If you were one of those women who've had a history of a high-grade abnormality within the last 20 years, then we would need to continue screening past the age of 65. And we'll take a question next from Sandra.
Hi, my name is Sandy Copeland, and I am a woman Marine from the early 70s. For many, many, many years after leaving the military, I had a lot of extreme co-symptoms, and I couldn't get any help to the VA. And so I went to a civilian doctor and found out that I exceeded the high percentage for Lyme disease, which they calculated that went back 40 years. This is how long ago I had tried to get help through the VA. And they discovered that, yes, I more than likely had gotten contact with Lyme disease at Camp Lejeune in the 70s. In fact, I tried to get help through the VA, and I even had a letter from one Marine that I was able to contact when we were cleaning the swamp, actually, and I had a tick on me. And I've done a lot of research with the Lymes, and it's also biuteral, and one of my 4 children ended up with the Lyme disease starting at birth. Now, my question is, why don't we have physicians that are educated enough in Lyme's disease where guaranteed there's like good 60-70% of our veterans probably did get contacted with Lyme, suffered a numerous amount of co-symptoms, but never got the help for it. Now, a civilian doctor was willing to put me on a port with IV bag every day for like 4 months. But another civilian doctor and him discussed it and figured I would be herxing and would probably kill me because it has been in my body for so long and so many severe co-symptoms from it. Why can't we get help through the VA? Why aren't there physicians educated enough in this horrific disease that they say, because I did not report it back in the 70s, early 70s, that it's not legitimate, when we didn't even know what Lyme disease was back then. So and I do appreciate all of you.
Thanks for your question, Sandra.
Yeah, so Sandra, have you seen anybody from infectious disease here at the hospital? Oh, well, okay, I apologize about asking you a question, but here's the scoop. Our infectious disease doctors see Lyme all the time. It's endemic in Wisconsin. And so they're very well versed with Lyme disease. So that's where I would suggest starting with a consultation with the infectious disease clinic. Now, I will tell you there's a lot of controversy out there about chronic Lyme disease, and you got to be very careful. So I want to caution you to make sure that you get information from a university infectious disease program that will be the most up-to-date on Lyme disease.
The other thing I'd just like to clarify, Sandy, when you started talking about this, you were talking about having to have another veteran verify that you had a tick on you. That sounded to me like you were talking about getting an assessment as to whether or not this was service-connected. And that's an issue, of course, for the VBA, the Veterans Benefits Group. And if that is one of the things you were talking about, then the county veteran service officers are the contact points that I would look for in every county in Wisconsin, if that's where you hail from, has one. And they can help you along that process.
Well, we're getting a couple more questions queued up here. We're just going to disperse a little information in between. So information on My Healthy Vet. My Healthy Vet's a website that we have that gives veterans the ability to secure message their healthcare team, view most of their medical records online, which includes lab results, looking at upcoming scheduled appointments, refilling medications online, lots of different cool features with that program. So veterans can log on to their account from anywhere as long as they have access to a computer, tablet, smartphone, anything like that. Signing up for an account is pretty quick and easy. First, you just can create a basic account online, and then you can show proof of ID to get upgraded to a premium account for free. You can do that showing proof of ID at any of the CBOC front desks. You can do it at the main hospital location in the Patient Education Resource Center. It's on the first floor of the main hospital. And then you can also call our My Healthy Vet Madison team at 608-256-1901 and extension 17173. And they can get you set up with a video call to confirm your identity and then be upgraded to a premium account from there, so you don't have to go anywhere. And we've also heard that from our women veterans that social media can be a limited means of connecting with you and providing our resources. So we have created our own women veteran group within My Healthy Vet to connect with our women veterans and share information that way on that platform. This group is specifically for women veterans and separate from your other healthcare team, so separate from your primary care secure messaging group. To be included in this group, you must have that premium My Healthy Vet account and an active email address. And then to find that group within My Healthy Vet, you do look for the Women's Health Care Coordinators team within Secure Messaging. All right, we'll get back to some questions here. We've got Kit. Kit, you want to ask your question? Can you hear us?
Yes. I wanted to discuss something that has to do with the mental health end of things. The first situation is that I've used the crisis line twice, probably in the last 10 years, when I've had exceptionally bad days. And the first time I had a good conversation, but they sent the police out to my house and kind of undid everything that the person on the phone helped me with, because I was just taken aback and shocked that the police were at my house. If you listen to the message about the crisis line, it says you're free to call and use it as a place to talk to someone. So the second time I called was just recently, and I asked first thing, I said, can you guarantee me you're not going to send the police to my house? And he said, no, I can't guarantee that. So I hung up, because I couldn't talk with that hung over my head, like I'm going to have my neighborhood police coming to my door again and, my neighbors seeing that and so on. So I just wanted to bring that up as something that has deterred me completely from ever using the crisis line. The second thing is I have issues where, use of the phone is hard for me. If I get triggered, I'll shut down and I won't be able to speak and stuff. And I had a recent discussion with my psychiatrist for a med review. And although all these, years I've been with the VA, I've had great care in medicine, she just happened to trigger me that day by saying a couple of things about not being able to renew my meds if I don't take them, and that maybe my husband wants me to try a little harder. And both of those statements just, shut me down, because in my head at the time when I'm wound up, I felt threatened that they were going to stop caring and giving me medicine, and then having someone tell me that I should go to my husband just kind of shut things down. So my thought was, if that occurs for someone like me, I can write about the fact that I was triggered and everything. But currently, I have had no communication with my doctor since that call. That was probably a couple months ago. And so I'm wondering if there was some way that there could be a follow-up communication, since I do well with, like, the printed appointment things and that sort of thing. If something could be mailed where, even if I have the form at home, where I could just fill out what happened, and then I could send that to be added to my record, instead of it just being this open-ended thing where I spent 2 days afterwards, shut down. But anyway, that's the gist of it as far as what I wanted to bring up.
We have Sarah here from Mental Health, too, who might be able to shed some light on the crisis line calls.
Yeah, thank you, Kit, and I really appreciate you sharing your experiences. I know it's really hard, and it sounds like it was difficult to reach out for help, and so I'm sorry that, things kind of didn't go the way you were hoping they would, and that you felt that way about how it all happened. It sounds like there's a couple different issues going on. Unfortunately, with the crisis line stuff, they do have their protocols that they follow, and so I can't speak to exactly what happened with that situation. But certainly the situation with your psychiatrist, my suggestion would be, if you feel like you can write it out a little bit easier than speaking on the phone, I would write a My Healthy Vet secure message, and we can make sure that your doctor receives that message, and just kind of let the doctor know how you're feeling and maybe explain some things so that hopefully we can prevent this from happening in the future. We certainly want you to feel comfortable and being able to discuss what's going on, even in like a medication review meeting. So that's really important to us. Also, if you feel more comfortable, we could also set up a triage appointment for you in our front door clinic, too, to talk with somebody face-to-face if that's a little easier for you versus talking on the phone or even writing it out on My Healthy Vet.
Thanks, Sarah. We'll move on to the next question. We have Janine.
Hi, this is Janine. I'm a veteran from Vietnam era, and I'm down at UW Hospital probably once a month for different appointments in different departments. This is really more of a suggestion, and it's been changed by other hospitals like UW and SSM. When you come in the front door, the main entrance, when they take your temperature, everyone else now where I go, they do it on the wrist. And in the main entrance at UW there in Middleton, they still do the thermometer right to the head. And I'm thinking about, and I've talked to different veterans, combat veterans, POWs, that's probably one of the worst things that you can do for these guys is to put a weapon at their head. I know it's a thermometer, but I even told them I would buy thermometers, more expensive ones, so that you could take a thermometer, take the temperature of the wrist. And I don't think it's that big of a difference as far as accuracy, but I think it would help the veterans a lot more, especially the ones that have really gone through a lot of trauma, and we're in a traumatic time right now. But anyway, it's a suggestion. Get thermometers where you can take their temperature with their wrist and not their head. Thanks.
Well, thank you, Janine, for the recommendation. We certainly will take that under advisement.
Next question, we have Aaron. All right, Aaron, you're on.
Hi, my question was just kind of a random thought while other people were speaking. Do you guys have in place or thought about any recreational type of support groups where women veterans can connect with each other? It's kind of a hard time to get out and socialize and find people you connect to, especially if you're dealing with mental health or PTSD, and being able to relate to somebody else and just have that extra support outside of the VA. Is that something you guys do?
Hey, Erin, it was a little hard to hear you, but I think I got the gist of your question. It sounds like you were wondering about opportunities for different women's groups, recreational groups, kind of opportunities for women veterans to come together and have that sense of community and support each other. Sarah, I know we've got a lot of mental health groups in the works specifically for women.
Yeah, I'm so glad that you brought this up, Erin, because it's a really good point. This is a hard time. It's a hard time of year, and it's a hard time with the pandemic right now. So we actually are really happy to offer a lot of new groups for women veterans through mental health service and through peer support. Let's see, we have our Madison peer support specialist, Ann Bolefeld, who is offering, it's actually by telephone, a strengthened recovery group for women veterans throughout the Madison VA. Then also has an exploration through music group, and that one's offered through Video Connect. So again, an ability to meet without the, COVID concerns. We also have a women's tea garden group offered through VBC, and that focuses on improving one's surroundings through indoor gardening and community building, and that's also offered virtually. We also have a writing in the community group for women veterans throughout the Madison area, and that's in partnership with Sequoia Library. We also have several coffee talk groups that are in the community for women veterans. We have multiple locations for that, including Rockford, Freeport, Janesville, Baraboo, Beaver Dam, and Madison. We also have a group, in-person group in Rockford. That's a Living Skillfully group that focuses on building DBT skills to improve quality of life and relationships. So if you wanted to call the mental health department, 608-280-7084. Again, that's 280-7084. We can give you more information about those groups and get you started.
Why don't you cover the whole health?
Oh, yes. And also, thank you. We have our whole health program as well, which has a lot to offer in terms of groups and individual health coaching. This includes classes. We have wellness classes through the Madison VA like Tai Chi, yoga, mindfulness. We have a list that you can get for all the classes through your primary care team. We also have the whole health number, which is 608-256-1901, extension 12537. Again, that's 12537. And we're hoping that we can have a calendar available on the Madison VA website with all the whole health offerings later this year.
There's also actually a contract throughout our Network 12, which goes from down in Danville, Illinois, all the way up to Iron Mountain, Michigan. And it's a contract that you join up a program that allows you to do in-home yoga and kickboxing and all sorts of different whole health approaches to care. And that's available to every veteran and every employee in our network. So you can ask about that as well.
Thanks for that question, Erin. All right, next up we have Megan. Megan, you're on. Can you hear us?
Hi. Good evening, everyone. Providers, thank you for your service. Veterans, thank you for your service. I just want to address Erin's question quickly before I get to my own question. It was, Erin, yes, we need to get some groups in Madison and throughout Wisconsin that will golf. I belong to the Veterans Golf Association in Wisconsin, but I'm probably like 1% of the population, so we need to increase that. And also pickleball is a big growing sport, and that's great to get out and socialize and just meet people. So we need to see if we can set something up through Whole Health, not just at the individual classes online, but if we could do some kind of community meet and greet, that would be fantastic. Okay, break. Next question is, I've had 2 appointments with a hip shot, and at this most recent appointment, I had a female come in while they were locating the location of the shot, but then she left the room. So then I became uncomfortable, so I'd like to know that the VA is actually looking at the protocol and making sure that women are safe in those kind of appointments where it may be a sensitive issue. Go.
Hi, Megan. Yes, we definitely want our women to feel comfortable when they are in an exam room, when they're having any sort of sensitive exam. And so our policy is for any sort of sensitive exam, pelvic exam, breast exam, even EKGs, anything where you might have anything exposed, we want to have a female chaperone present in the room. So thank you for bringing that up, because we definitely need to make sure we're providing that female chaperone for our patients.
Yeah, and this is Dr. Bridges. You can always ask for a chaperone if you feel uncomfortable. So no matter what exam it is, you can ask for that, and we will get that assistance. So yeah, thanks for that question.
All right. Question from Kathy. Kathy, you're on.
Oh, hi. I didn't want to speak, but since you got me online, because it was kind of close to what Erin said, I do have PTSD and depression issues, and lately with COVID, it's really difficult to get out and do anything. And so I called, and I guess I called the wrong department, because I left a message. Is there any activities or crafts that I could get my hands on so I could do it when I'm home, to just shut my brain off for a few hours a day? And I asked them to just leave me a point of contact, because I guess the operator did not connect me with the right department.
Go ahead.
Hey, Kathy, thank you for bringing this up, and I'm sorry that you were waiting to kind of hear from somebody. I had 2 thoughts that came to mind. This is Sarah from Mental Health. The first one is talking with our peer support specialist and kind of thinking about some ideas, and perhaps one of the groups that we have available currently in the community might fit the bill, or at least give you some more ideas on some activities. And my other thought was our Whole Health program. And with Whole Health, they have individual coaching to kind of help you think about activities. It's really what matters to you in the situation, so kind of really personalizing it and figuring out what your interests are and what activities might make the most sense. So those would be my 2 suggestions for you at this time. So thank you for your question.
Thanks, Kathy. It looks like we have a couple minutes left in our town hall today. We can maybe have time for one more question here. Linda? Linda, you're on. Can you hear us?
Yes. My question is who do I talk to, or what department do I contact regarding disability rating qualifications?
Hi, Linda. This is Liana from Patient Administration Services. I can get your information, and then we'll give you a call back with the point of contact. It will be your CVSO, your Veteran County Service Officer, as this is a task for the VBA and not the Madison VA Hospital. But we will be glad to put you in contact with your CVSO.
Thanks, Linda. So thank you all for participating. That's all the time we have left today for questions. But if we didn't get to your question, please stay on the line, because in a moment we'll have the chance to leave a voicemail with your questions that we weren't able to get to, or any comments or feedback that you might have for us. And then please know that we've recorded all of the questions in our queue, and we'll make sure that everyone who has raised a question or today we'll receive a response. We plan to get back to all our callers within the next couple of weeks. And then before we go, we also want to remind everyone on the line of the importance of suicide prevention. At VA, prevention of veteran suicide remains our #1 clinical priority. We encourage everyone to put the Veterans Crisis Line number in your phone. And that number is 800-273-8255. Again, that number is 800-273-8255. Again, we encourage everyone to put that number in your phone because you never know when you might need it, or you might encounter another fellow veteran in the community who might need it, and you might never know when that might save a life by giving that to somebody and connecting a veteran in crisis to support resources. And one last time, that number is 800-273-8255. Again, thank you for joining our Town Hall today, and have a great evening.